Balance in the medical field. This is a physician who cares for hospitalized patients, is a researcher and associate professor at UCLA. All right, Doc, as we look at this and we keep hearing these numbers of surges and doubling of case counts and tripling of case counts, are those really the right numbers to be paying attention to?
That's a great question, and they're not. Those numbers are really about the panic and the hysteria and the hype that we've seen over the past year and a half. I mean, what really matters, what's always been the thing that matters, is whether people are getting sick and whether people are dying. Because it's just not possible to stop people from catching viruses. I mean, it's a fool's errand.
So are we at the point to understand, in your esteemed medical opinion, that if we're vaccinated, we go about our daily lives, and those that are unvaccinated have to sort of make a choice if they're willing to accept the risk of being unvaccinated, because it's going to be impossible to know if you've got vaccinated people who are asymptomatic carriers in the same way people walk around all the time during a cold season and have sniffly noses, or maybe carrying cold viruses that their immune system makes them asymptomatic to?
You're absolutely right. That's just how it is. That's what it means to be a human being. And these new rules that we've developed for COVID are extremely destructive. I mean, they're destructive for relationships. We've seen the damage that they've done to children and their development with school, the masks for kids. And I've seen, many children who are fearful, and that's not what we want for our American children or children anywhere in the world. Children are supposed to be fearless. So it should be treated just as you described, just like other viruses that we live with and will continue to live with indefinitely.
Well, living with indefinitely is scary. The fact that the vaccine works so well makes it a lot better. This headline caught our attention, one of our competition. This is from CNN. More than 91 million live in U.S. counties with high COVID-19 infections. It's time to reset and put masks back on, experts say. Directly contradictory to what you're saying, but it also seems as though that there is a desire by some in the medical profession to hype this to the point of continuing the pandemic and managing cases to zero.
Yeah, I mean, you're absolutely correct. And the mask pursuit, it really has taken more the shape of either, a political crusade or almost a religious obsession. It should be obvious to anyone who's paid attention with all the mask mandates all over the country over the past year and a half. I mean, they were not significantly effective. What is effective? Immunity is effective. That's what's effective for stopping viruses and stopping illnesses. But the masks, at most, they have a modest impact on transmission epidemiology. I mean, that's quite obvious from the past year and a half. But you just can't get some people to quit their, sort of obsession and just faith
the same
and just deep
time,
belief
Doc, and I've only
in
got
these
about
masks.
30 seconds, so forgive the interruption. But back to Brian Enton's report, that there are a lot of young nurses down in Miami, and I'm sure at hospitals that you work at as well, who say they're not getting the vaccine out of these fears of it's not been tested long enough in pregnant women. What about them? What are they to do?
Well, a real issue, it's very important. So, there are a few different things. We know that this virus, it concentrates its harm in people who are older, people who are obese. So there are, we can't change anything about our age, but we can change something about how healthy we are. And the other thing that's been really overlooked during this whole pandemic, to the detriment of the United States and people all around the country, is early outpatient treatment. So there is evidence for things like hydroxychloroquine, ivermectin, fluvoxamine, inhaled budesonide, especially when they're used early. But they've been politicized, so people don't know they can be treated.
Yeah, sadly, I was too healthy at the time, they thought, when I got COVID, to get the antibodies, the Regeneron antibodies. Ended up in the hospital myself with it. So there are those cases. Doc, we appreciate your expertise as well, and I know nobody's looking forward to getting back to those days in the long days in the ICU. Dr. LADAPO, we appreciate it. Good to see you, sir.
Okay, thanks.
Thanks. And in Los Angeles, Chef Andrew Gruel, friend of the show, founder, executive chef at Slapfish Restaurant. It's an award-winning food truck turned international brick and mortar.